Some area ophthalmologists now offer an all-new blade-free laser cataract surgery. It is a first of its kind in Alabama, and Focus at 4's Linda Mays reports it's mapped out to give cataract patients exactly what they want.
Kendrick Ford wants to be free from eyeglasses, and astigmatism, or unnatural curve on the eye, first led him to wearing glasses at age 45.
But if I'm reading a newspaper, I can read it fine. It's just anything in the distance, and it still doesn't help with the glare. The glare gets me, and then my eyes start burning.
Now the 62-year-old retiree has a new diagnosis of cataracts. Left untreated, a person can lose all vision. Ophthalmologist Dr. Mark Bearman explains using this eye model.
The lens of the eye is behind the iris, which is the brown. A clear lens looks like this, just like your camera's lens. A bad cataract would look like this. When it looks like this, you obviously can't see through it.
More than 3 million cataract surgeries are performed each year in the United States. It's one of the most common procedures worldwide.
So we need to talk about the options.
Dr. Mark Bearman is among a group of doctors that is now first in Alabama to offer blade-free surgical laser cataract surgery. This is the high-tech LenSx femtosecond laser, designed to perform refractive cataract surgery with precision. The procedure involves replacing the eye's cloudy natural lens with an artificial lens implant.
What this laser does is takes out some of the possibility of surgical error by the surgeon. It improves both the quality and the precision of all of our incisions, and it does the first parts of the cataract surgery for us, which I think are some of the more difficult to perform manually.
The LenSx laser uses 3D image-guided technology that maps the patient's eye and etches exact incisions. Dr. Bearman says traditional cataract surgery is performed manually by the surgeon using a blade for all incisions.
So we take this cataract out from back here through this opening, the pupil, and put an implant in its place. Then with this pupil dilated, it will tear open the wrapper that is wrapped around the cataract, and it will cut the cataract itself into quadrants, leaving an empty bag, leaving an empty wrapper where the implant goes in that wrapper.
The LenSx cataract surgery takes only 10 to 15 minutes. It's typically done using local anesthesia with the patient sedated but awake. The possible risks include infection. However, Dr. Bearman says the LenSx will make all cataract surgeons better surgeons and make an already safe operation safer. There are also now more implants or artificial lenses available to help correct the patient's vision.
Now we have implants that can help people see up close, far away, intermediate. We have implants that correct astigmatism. Patients are beginning to demand the kinds of results that this laser can deliver.
As Mr. Ford says, I want to be without my glasses, and that's
Sure.
what they're demanding, yes. Now, VisionFirst Eye Center's LenSx laser is located at Shelby Baptist Medical Center. And by the way, Mr. Ford is scheduled to have his surgery in 2 weeks.
No, it's going to go well for him. Cataracts grow at different rates. So when does a person know that it's really time to have the cataract surgery?
They will know if it begins to interfere with their daily routine, if they're having difficulty being able to see, to drive, or to read, to do whatever task they have before them.
But just go to the doctor and find out.
That's right. And by the way, once you have the cataract surgery, the cataract is gone for good. And recuperation with this laser is shorter than before.
No.
And Dr. Bearman says that the patients should begin seeing well the next day.
Can't ask for more than that. Thanks,
Really?
Linda.
Certainly.
We'll be back with more in just a moment.